Hi, my name's Simon Cabot. I'm Regional Clinical Lead Physiotherapist for Nuffield Health. Did you know that exercise is recommended by the government for many arthritic types of pain? Exercise helps lubricate the joints, increases range of movement, and increases functional capacity, which is vital as one is aging. We're going to be going through some simple exercises today that can help get you started. If any of these exercises cause pain though, please ensure that you see a professional. And I'd advise you see a professional anyway, as a tailored program is much more suitable to your individual needs. Arthritis in the wrists and hands is very common and also very debilitating. So we're going to start with some very simple exercises to get the wrist moving. So we're going to start by pointing the palms towards the ceiling and then rolling the hands and palms towards the floor and just oscillating between those two positions to get the wrist and hand moving. Ideally doing 10 repetitions and 2 sets of those exercises to start with. And as always, if there's any pain with these, please stop. The next exercise we're going to do is going to target the fingers. And it's a very simple exercise where you're going to be spreading the fingers out and then making a fist. Spreading the fingers all the way out and then making a fist. These exercises should be relatively pain-free. There may be some minor discomfort, but it certainly shouldn't be sharp or debilitating. Let's move to the other extremity, the foot and ankles. Here's some more simple exercises to get the foot and ankles moving. This time what we're going to do is start to make circles with a foot at a time. Nice big circles, again within your pain limits. And then the other variation to add is pointing the toe and then pulling the toe back towards you. Getting a nice stretch on the calf and then pointing the toe away from you. The next exercise we're going to do are going to target the hip and knee. So the first one is simply bending the hip and knee up towards your chest, supporting behind the back of the leg and pulling the thigh towards your chest comfortably, and also bending the knee and straightening out. And alternating legs, and again this is just getting things moving, starting to get that joint moving more than what it has done for a while, which is obviously going to help increase the function. There's another exercise that I'd now like to show, and this is called a straight leg raise. And as it says, you're going to keep the leg nice and straight and then lifting towards the ceiling to about 45 degrees, 60 degrees, and then slowly lowering. With this exercise, it's really important you try and keep the knee as straight as possible and tightening up the muscle in your thigh to help activate those muscles around the knee and hip. Now let's go on and start to loosen up the spine. So we're going to do some very simple exercises to start flexing the spine initially. So pulling both your knees towards your chest at the same time. And just holding there comfortably for a few seconds. Again, keeping everything nice and comfortable, and then slowly releasing. And repeat that several times. Pulling up towards the chest, using your hands to support the back of your thighs. There are progressions that we can add to this, so if this does seem too simple, again, you definitely need to see a professional to advance your exercises. The next exercise for the spine is a simple rotation exercise. And what we're going to do here is allow the knees to gently rock to the side in each direction, keeping the shoulders on the mat while allowing the knees to rotate each side. And again, listen to your body and go within your comfort. These exercises may be slightly uncomfortable, but they should actually feel pleasant. The next exercise is a buttock stretch. Now the buttock stretch may actually be provocative, particularly if you do have hip arthritis. So it's something that we can try, but again, if there's anything that's sharp and uncomfortable, please don't attempt this exercise. So how we do this is we bend one leg up, cross the other leg over the knee, and then using your hands to pull this thigh towards your chest. And importantly, lie flat and keep your back nice and straight as you're doing that. Holding there for a few seconds and then releasing and coming back down. And swapping sides, lovely. There we go. And holding the stretch there. And the stretch you'll feel should be around this hip area. And again, if there's any pain with this, please stop this. Let's finish for some exercises for the neck and shoulders. Now these exercises are basic functional movements, the movements that your neck would normally go through in the day. The exercises are looking up and down, left and right. And again, you're going to the end of the movement that is comfortable. So trying to extend, looking all the way to the ceiling, and then all the way down to the floor, getting some nice stretching. And then starting the rotation where looking over your shoulder, trying to keep your posture relatively upright and vertical. And again, all of these should be relatively pain-free. You could also incorporate some simple shoulder rolls as well, just simply rolling the shoulders back. Lovely. These exercises we've gone through today are suitable for people with osteoarthritis. The key take-home message from today though is keep your body moving.